Thank you for joining the Essential Therapies podcast. Dr. Cindy here, and we are wrapping up our discussions on the calm technique during this road reflections, my country commute drive into town. So we, for the last 4 sessions, have been talking about listening to your body and really figuring out how do we address self-treatment in a more complete way. How do you learn what to do? It starts with really connecting to your body, which is the beginning of the calm technique. So if you didn't listen to those previous podcasts, I encourage you to go back to, I believe it was number 36, where we talked about connecting with your bodies. And then the next one, starting with C for connect. Then we go A to assess, L for listen. And today we are talking about move. What does move stand for in the calm technique? So if you remember, I came up with this idea when I was one day figuring out how can I help my patients get better at their own self-treatment, because I have really done amazing things with my own body, which started back when I really needed some myofascial treatment and there was no one in my area to do it. So I really had to travel to see other therapists out of state. Usually I would go to courses, which isn't really like getting treatment, but I didn't have somebody right there. So I took what I knew as an exercise physiologist and yoga instructor and someone who could really, begin to feel in my body. I was able to treat myself, and this is what I came up with, the calm technique, where I realized I connect with my body and I really assess, which kind of comes from my physical therapy background, where we really assess the problems, which is really kind of left brain, or the John Barnes approach of channel 5, right? And then listening, which is bringing in that feeling sense, that paying attention to what's going on inside the body, which was something I really had to develop as someone who was very left brain, had a lot of education, and was always studying and learning and really kind of intellectualizing everything, and had to turn that into that feeling sense, that listening into our bodies. And it really helped me a ton. But then I realized there's more to this, and that's M for move. Now, move could mean many, many things when we think about self-treatment and the fascia, because movement is very important for our bodies. If we don't move, that fascia begins to solidify down, that ground substance gets hardened, and we are not freely flowing. And if you think about it, we are mostly water, right? Most people know that. Even kids know, hey, we're mostly water. We're like 70% water. And that number varies depending on who you listen to. But the point is, we should be much more like Jell-O and not like concrete. However, a lot of us experience at times, and some people quite significantly throughout their whole body, feeling like concrete and not like Jell-O. So movement is extremely important, and that movement can be exercise, it can be all kinds of different things. But what about other aspects of move? So sometimes I joke around that, you've done the calm technique, connect, assess, and listen, but you got to move yourself off the couch sometimes just to get into the position of doing these things that are going to help. So sometimes it's, yes, move off the couch and let's get on the floor and grab your favorite self-treatment tool, or maybe you don't even need a tool, you're just going to do some lengtheners, whatever the case may be. So sometimes we start there. But movement also means, or move also means, that we need to allow our bodies to move. So if you are truly listening to what's going on in your body, and you're letting go of tensions and just feeling into this space of freeing up your tissues, if you sit with this enough or long enough and learn to let go of tension, you will begin to feel your fascia soften. And when the fascia softens, it starts to move, or allows your body to move. And sometimes it's just a lengthening of that tension that is maybe pulling up on your pelvis and pulling your pelvis up to your rib cage, and maybe even it's shortening the leg on that side. And that movement might mean, as that softening occurs, the pelvis moves down into a more normal position. It might also mean this idea of unwinding. So myofascial unwinding is a part of the John Barnes myofascial release approach, where we acknowledge and honor the body's ability to release and let go of subconscious holding patterns that sometimes result in some spontaneous movement from within. So what exactly does that mean? So that could be very localized in your musculoskeletal system, that you might actually feel some part of your body roll out. Let's say you're in legs up the wall and your leg starts to roll out a bit, or your arm starts to move into another position. Maybe your neck starts to move around a bit. I'll never forget my first spontaneous unwinding during self-treatment. It was many years ago, over 25 years ago now. And I was in legs up the wall for quite a while. I was really needing some relaxation, and my body was really feeling tight, and I was really tired. So I let myself just really go into this state of feeling. And it was really when I was getting good at listening to my body and just letting go. And I remember my legs were in the straight up position, and it just felt so good. My arms were out to the side, and this opening was just amazing. And all of a sudden I realized my neck was felt different, and my head had started to move. So there was this very slow, smooth movement that was happening in my head and neck. You might imagine just kind of your head turning to the side and maybe looking up to the ceiling, almost like the top of my head was doing a sort of a figure eight. And I thought to myself, wait a minute, I'm not doing that. I I was observing it, and I could feel it. It was felt amazing, but I was not consciously moving my head and neck around. And that was unwinding, true, spontaneous, from within unwinding. And what happens is the fascial system, as it's holding all of our emotion and our memories, our traumas, our joys, all of our consciousness, and as we give it an opportunity to soften into a space to let go of a subconscious holding pattern, which takes at least a good 5 minutes for this to begin to happen. Usually, as we think about the connective tissue and the collagen aspect of the fascia, we're talking about this 5 minute time period as a minimum. And I don't know how long I was there. I know it was quite some time. And not that some people can't allow this unwinding to happen sooner than that, because it's different than letting the collagen release. It's letting a subconscious holding pattern go. And the better we get at this idea of tuning inward, being in channel 3, being connected to our inner higher self, and allowing softening to happen as we let go of all the things that are no longer serving us, the body may begin to go into this movement pattern. There's no necessarily rhyme or reason to exactly the movement that will happen. It's never exactly the same, but it's an allowing. So if you can think of allowing your body to soften, because a lot of times we get into these positions for self-treatment and we have an agenda, right? We're stuck in this channel 5 left brain. This is what I want to have happen. We're super attached to the outcome. This has to happen right now. Unfortunately, we're not really allowing the body to move in the way that it needs to fully release these subconscious holding patterns. So that is what I mean by move in the sense of unwinding. Allowing our body to move can also be a very localized structural thing, where I like to think of unwinding as letting go of this emotion, or this stuck emotional or conscious, unconscious, and conscious energy that we hold in our body through our being, right? But we can also let go of this structural change, which then you'll feel the body move into a different position. For example, I'll use legs up the wall again, because it's just something that I do all the time. And it's an easy way to kind of experience this yourself. If you're feeling a lot of tension and you're used to doing legs up the wall, you know what I mean? Sometimes you'll notice that your ankle bones that stick to the middle, towards each other, one is higher toward the ceiling than the other. So it's showing an imbalance in your pelvis. And that is being caused by restriction in the fascia higher up the chain, usually in the pelvis and the trunk somewhere, might be in your hips or somewhere as well. And so I will often get to that position and notice that my right leg is short. That's just my typical pattern. And as I soften into it and doing the calm technique and letting go, and my body starts to move, I can actually see the change in my ankles and the height of them through this process. So there has been some movement that has occurred throughout my skeletal system. Another thing that can happen that I do often is lie on the half foam roller or rolled up towel under my upper body, really kind of opening the chest, and maybe even the foam roller down the spine, allowing that tightness in the front chest to release and let go. So you're feeling the roller between your shoulder blades. And as you're there long enough, you might begin to feel the softening down of that whole shoulder girdle toward the floor. And when that's happening, that's also a movement, right? So that moving is allowing your structure to be in a different place. It's allowing that compression to soften and change, then allowing more flow within the body. And how that might turn out more functionally is, you can think of the analogy I enjoy using is stepping on a garden hose. So if we step on a garden hose, we're trying to get water out the other end, it's going to diminish at the very least, and maybe even be completely occluded, right? As we relieve that foot off of the garden hose, then we have flow again. Same thing is happening. I like to think of it in the body as the fascia. When it is tight and compressed and solidified, it is like the foot stepping on the garden hose to all of the structures that go through it. Remember, the fascia doesn't just go around muscles and organs, it goes through them in this three-dimensional system called biotensegrity. So you've got blood vessels, nerves, organs, lymphatic vessels. All of these things can be compressed, and many of these are very painful if there's compression. So there's pain-sensitive structures that are at risk because of the solidification that occurs in the fascia. So when we connect and we assess, we truly listen and let go, we can allow the body and our mind and our emotions and our subconscious holding patterns to move through us, so that we no longer have this compression on the garden hose or compression on important structures in our body, including organs, right? All of the structures that are there that need flow, they need fluid, they need movement to have the best situation possible, which means improved quality of life, feeling good now, and really creating a younger body as we move through life. So yes, aging is inevitable, right? But the way that we age is really kind of up to us. So I just want to remind you, now that we are wrapping up the calm technique, consider maybe even re-listening if you're not sure, you don't remember exactly, and think about, if you add this to your self-treatment routine, how could you add it? And then follow here for more, because we're going to be coming up with more videos, more programs, more educational things to help you improve this for yourself, because really you are with you 24/7, and myofascial treatment is amazing, but I want you to be able to experience the benefits of really understanding your body, mind, and being able to help yourself. Because every day when I wake up in the morning, I do not feel as good as I do within a half an hour, because I'm connecting to my body and doing a lot of these little things all throughout my day, which really, really help. So I want to remind you that you are creating tomorrow's body today. Stick with it, continue to learn, and thank you so much for joining. Stay tuned, and please share with someone else who can benefit. Have a great day.